Hello everyone, I'm Nelly Ziade, Associate Professor of Rheumatology from Beirut, Lebanon, reporting for Room Now from the EULAR Congress in Barcelona. I had the pleasure to interview earlier today Dr. Fabian Proft. He's a division head of rheumatology at the Charité University in Berlin. He's a GRAPPA steering committee member, Young GRAPPA past chair, and Young ASAS chair. Dr. Proft presented on Thursday a talk, OP0175, on establishing definitions for complex to manage and difficult to treat psoriatic arthritis, the insight from the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, GRAPPA initiative. So, as you know, many patients with psoriatic arthritis experience treatment inefficacies and persistent burden of disease. Less than 50% will reach the state of remission. So the idea of GRAPPA was to develop consensus-based definition to address the reasons for this treatment failure in PsA. So briefly, the methodology started with a literature review, then surveys with derma, rheuma, and the patient research partners included. They did an initial draft, which was reviewed by the steering committee members, Delphi round 1, Delphi round 2, and then voted by GRAPPA members, and finally the final consensus. So I will take you directly to the definition. So the definition of the complex to manage psoriatic arthritis, it's a disease state characterized by persistent symptoms despite at least one adequate trial of a TS or biologic DMARD recommended for PsA treatment as per GRAPPA recommendation. And this definition received 89% agreement. It's meant to be a broad definition to include not only persistent inflammation, but also other status like comorbidities, overlapping condition, and some treatment-related challenges. So when I asked Dr. Proft about the choice of the complex to manage PsA, he said that it was mainly the choice of the patients, because as you know, in RA and in AS, we have the difficult to treat and the difficult to manage. Actually, the patient had their voice at this GRAPPA consensus definition, and they felt that the term difficult is like a bad connotation for them and bad label. And they instead insisted on having complex to manage psoriatic arthritis. The second definition is a smaller group of patients who are more difficult or more complex, and they label them difficult to treat psoriatic arthritis or treatment refractory psoriatic arthritis. So this is a state defined as a failure to respond to at least 3 previous treatments for PsA with different modes of action, including at least 2 TS or biological DMARDs, and persistent symptoms perceived as problematic by both the treating physician and the patient, and the presence of objective evidence of inflammation. And this has received an agreement of 100%, and the whole project received an endorsement by 95% of the GRAPPA members. Also, I asked Dr. Proft, why are you choosing 2 definitions for this difficult or more difficult group of patients, so difficult to treat and treatment refractory? And the idea was that they wanted to be in line with the psoriatic arthritis definition and with the axial SPA definition. So the psoriatic, the rheumatoid arthritis definition and the AxSpA. The rheumatoid arthritis is D2T, difficult to treat, and the AxSpA is treatment refractory. So for now, they kept both of them to indicate this particularly challenging group of patients. So this is the first consensus-based definition for treatment failure in PsA. We hope that it will start a new research project and will be a help to better understand the reasons behind this treatment failure. Thank you for listening, and please follow Room Now for more coverage from EULAR 2025 in Barcelona.